my name is Allie. Can you tell me your name?
Sophie.
How old are you?
16.
So today you're in for an abdominal assessment. Do you have any questions before we get started?
No.
So the first thing I'm going to do is get down at eye level. I'm checking the contour and the shape of your abdomen. I'm looking at the color, the any scars or striae in your umbilicus is nice and midline, and there's no pulsations or peristalsis noted. The first thing I'm going to be doing is listening to your bowel sounds. Okay, now I'm going to be listening to vascular sounds. Your aortic, your renal, your iliac crest, and your femoral. Next, I'm going to be doing some general percussion. I'm just going to be doing some tapping. Anytime you feel tenderness, let me know. Any tenderness? Okay, can you sit up for me and turn that way? The next thing I'm doing is checking your kidneys. If at any time you feel tenderness, let me know. Any tenderness? Okay, you can lay back down for me. Now I'm going to be doing some palpations. So I'm going to do some light palpations first. Any tenderness? Now I'm going to go a little deeper. Any tenderness there? Okay. The next thing I'm going to be doing is checking for any organ swelling. The first thing I'm looking at is your liver. Any tenderness?
No.
Can you take a big deep breath for me? Okay. The next I'm going to be looking at is your spleen. Any tenderness? Okay. And now your kidneys. Any tenderness?
No.
Okay. The next thing I'm going to be doing is your specialty test. The first thing is your Murphy sign, which is checking for your gallbladder. Can you take a big deep breath for me? Okay. Any tenderness when I let go? Okay. The next thing is your Bloomberg sign, which is your appendicitis. Any tenderness? What about when I let go?
No.
Okay. Next is your McBurney's. Any tenderness?
No.
What about when I let go?
No.
Okay. And then the next thing is checking also for your appendicitis is your iliopsoas. Lift up your legs. Any tenderness?
No.
Okay. Lift up. Any tenderness?
No.
Okay. And that completes our abdominal assessment. Today we did a abdominal assessment on a 16-year-old female. We started off with assessing her abdomen at eye level. It was nice and symmetrical. The color was appropriate. No scars or striae noted. Her umbilicus was nice and midline, and no pulsations or peristalsis noted. We then moved on to listen with our stethoscope to her bowel sounds, which were active times 4 quadrants. We then listened with the smaller part of our stethoscope, which was called the bell, to her vascular sounds. Her vascular sounds are her aortic, her renal, her iliac crest, and her femoral without thrills. We then assessed, we did general percussion with resonance heard. We then moved on to the CVA tenderness test, where she denies tenderness. We then moved on to assess or palpate light and deep palpations. She denies tenderness. We then moved on to assess her liver, spleen, and her kidneys, where she denies tenderness and no swelling was noted. We then moved on to her specialty test, which she was negative for Murphy's, Bloomberg, McBurney's, and her iliopsoas.